In this procedure, you will learn how to pour a sterile solution into a sterile container sitting at the edge of a sterile field. Sanitize your hands and make sure they are completely dry to reduce the number of transient flora on your hands and forearms. Moisture on your hands may contaminate the pack. If you will be assisting with a surgical procedure immediately after this procedure, perform a surgical hand scrub. Use the transfer forceps to move the bowl to 1 inch from the edge of the sterile field. Check the label of the ordered solution. Always perform 3 label checks before administering any solution or medication. Place your hand over the label and lift the bottle. If the container has a double cap, set the outer cap on the counter, inside up, before proceeding. With your non-dominant hand, lift the lid of the bottle straight up and then slightly to one side. Air currents carry contaminants that could settle on the inside of the lid, so continue to hold the lid facing downward. Check the label again before pouring. Spills down the side of the bottle can stain the label and make it unreadable, so pour away from the label without crossing over the sterile field. Do not allow any part of the bottle to touch the bowl or container. If the container does not have a double cap, before pouring the solution into the sterile container, pour off a small amount of the solution into a waste receptacle to rinse any contaminants off the bottle lip. Solution spilled on the sterile field will contaminate the field, so tilt the bottle up to stop the pouring while it is still over the container. Being careful not to touch the internal surface of the lid, replace the cap or caps off to the side, away from the sterile field. Check the label again to make sure you poured the correct solution.